My name is Lucas Nickel. I'm a Johns Hopkins orthopedic surgeon specializing in hip and knee joint replacement, practicing out of Columbia, Maryland at Howard County General Hospital. In a full knee replacement, the disease is often affecting more than one part of the knee joint, so both the inside and the outside part of the knee, along with the area underneath the kneecap. In this situation, we're removing the cartilage from all portions of the knee and replacing it with metal and plastic. In a partial knee replacement, we're leaving the outside cartilage alone and we're replacing the inside part. And so we remove a thin layer of cartilage from the inside and replace it with metal. And on the femur side, on the thigh bone side, we're also replacing a thin area of cartilage and bone and then placing a piece of plastic in the middle. But the outside portion of the knee is remaining intact. Knee replacement is performed by making an incision down the front of the knee and then accessing the knee joint by going to the inside part of the kneecap and moving the kneecap to the side. We then remove the cartilage and a thin layer of bone from either side of the knee and from underneath the kneecap and replace it with metal and plastic parts. The metal and plastic parts are secured in place with either bone cement, or some newer design of knee replacements have parts that will grow into the bone. The recovery from knee replacement is a little different for every person. In general, most patients are either going home the same day or spending a day in the hospital. Most patients are using a walker for a week or two and using a cane for several weeks after that. And by 4 to 6 weeks, most patients are not requiring any assistive device for ambulation. Most people are getting back to doing normal activities like going out to dinner with friends or driving within 4 to 6 weeks. Most people are doing rehab, which is supervised physical therapy, for 4 to 8 weeks. Prior to surgery, we do try to make sure that you are as healthy and ready for the operation as possible. And so we have all patients go through a joint replacement class. We get blood work to make sure that you're healthy enough for surgery, and we have you see your primary care doctor. Prior to surgery, paying attention to nutrition and hydration is very important. We have all patients start hydrating several days before the operation, and trying to make sure that you're eating a healthy, balanced diet leading up to the operation is beneficial. After surgery, patients have an increased need for protein to aid in wound healing, and so being on a protein shake or other supplementation is a good idea, but is not required. We also encourage all patients to go to physical therapy for a prehab visit to help learn how to use a walker, navigate stairs, and get in and out of a car after your surgery. We find this makes patients' recovery go a little faster, especially in the first week. Some patients develop arthritis in both knees at the same time and have symptoms on both knees at the same time. In those patients, they are candidates for either having both knee replacements done at the same time or having one done and then staging the second operation several months later. The advantage of doing both knee replacements at the same time is that there is only one recovery period. However, there is a little higher risk of anesthesia-related complications because the surgery takes longer. There's a higher risk of bleeding requiring blood transfusion, and there's a higher risk of some other complications like heart attack or stroke. For this reason, we generally only do bilateral simultaneous knee replacement in patients who are healthy. The other downside of doing both knee replacements at the same time is that recovery is harder because you don't have any good leg to stand on. So for this reason, patients tend to stay a little longer in the hospital and recovery is often sort of prolonged. After knee replacement, patients do physical therapy to regain range of motion and to improve their walking. Long term, most patients find that running and jumping activities are not really well tolerated on knee replacement, but most other things like hiking, walking, golf, or even tennis can be performed on a knee replacement. Before leaving the hospital after knee replacement, we will expect that you're able to walk and get up and do activities such as go to the bathroom or get to the kitchen. So you will not be in a wheelchair when you leave the hospital. You will expect to need some help around the house for a week or two. And so for this reason, it is important to have a coach or friend who can help you get through the operation and be there to help assist you, especially for the first week. There are some lifestyle changes that can impact your likelihood of recovery or complications after knee replacement, and one of those is smoking. We do know that smoking greatly increases the risk of complications after surgery because it slows down wound healing. When we do surgery and we make an incision, there is a race between bacteria trying to get into the wound and the body trying to heal the wound. And if that process is slowed down through the use of nicotine, then that can increase the risk of infection. One of the biggest risks and the things that we worry about the most after knee replacement is infection risk because it is so catastrophic and life-altering. So for that reason, at Johns Hopkins, we do require patients to stop all nicotine usage for a period of time prior to knee replacement to lower the chance of infection.